Contrast phases in radiology. When performing studies such as CT or MRI scans with contrast, understanding the different phases of contrast enhancement is essential for accurate diagnosis. These phases correspond to specific times after contrast injection, reflecting the vascularity and tissue perfusion of organs and lesions. Below is an overview of the key contrast phases with reference to radiology images. 1. Early arterial phase, 15 to 25 seconds. Description: the contrast first enters the arteries, highlighting arterial structures. Radiology image reference: look for images showing bright enhancement of arteries such as the aorta, hepatic arteries, or renal arteries. Clinical significance: useful for detecting arterial abnormalities, aneurysms, or hypervascular tumors. 2. Late arterial phase, 35 to 45 seconds. Description: continued arterial enhancement, with more uniform and intense arterial visualization. Image features: complete arterial tree enhancement, with some early parenchymal enhancement. Application: useful for characterizing hypervascular lesions like hepatocellular carcinoma. 3. Hepatic arterial phase, 17 to 25 seconds. Description: like early arterial but specifically focused on the liver. Image reference: liver images showing arterial phase enhancement, highlighting hypervascular liver lesions. Uses: detecting hypervascular tumors or metastases. 4. Late hepatic arterial phase, 40 to 55 seconds. Description: peak hepatic arterial enhancement. Images: liver images with intense arterial enhancement, often used to differentiate lesion vascularity. Portal venous phase, 65 to 80 seconds. Description: contrast opacifies the portal vein and hepatic parenchyma. Image features: uniform enhancement of liver tissue, visualization of portal vein branches. Clinical role: ideal for detecting liver metastases, abscesses, or tumors. Hepatic venous phase, 75 to 85 seconds. Description: contrast enters hepatic veins, which become prominently enhanced. Images: visualization of hepatic veins and the hepatic parenchyma, useful for assessing vascular anatomy and pathology. Delayed hepatic phases, 3 to 15 minutes. Early delayed, 3 to 5 minutes vascular equilibrium, with contrast starting to wash out from hypervascular lesions. Late delayed, 10 to 15 minutes peak washout, useful for characterizing lesions like hemangiomas or metastases. 8. Parenchymal pancreatic phase, 40 to 60 seconds, published. Description: pancreas enhancement while surrounding tissues are less enhanced. Application: detection of pancreatic tumors. 9. Enteric phase, 40 to 50 seconds, published. Description: intestinal lumen enhancement. Uses: detecting GI tract pathology. Corticomedullary phase, 30 to 70 seconds. Description: cortex and medulla of the kidney enhance variably. Images: renal cortical and medullary differentiation. Nephrographic phase, 80 to 130 seconds. Description: uniform cortical and medullary enhancement. Application: evaluation of renal masses, cysts. Excretory phase, 3 to 15 minutes. Description: contrast excreted into the collecting system. Images: visualization of the renal pelvis, ureters, and bladder. Systemic venous phase, 3 minutes. Description: whole venous system enhancement. Corticomedullary phase, the first phase of renal parenchymal. Nephrographic phase, the kidneys after and for contrast injection. Excretory phase, which opacifies the urinary collecting system, ureters, and bladder. CT systemic venous phase, performed after intravenous contrast has been administered, with imaging taken during the phase when the veins have the peak concentration of contrast.